health fair this year went really well. And for me, one thing that was an impact was how flexible everybody was. So like even when there was challenges, everyone really flexed around that and filled in the roles that were necessary.
It's really a good opportunity to serve people, and I truly enjoyed this year's health fair. And just seeing how persons were pleased, the quality of service that was offered, it was really, really excellent. And just the level of care that the volunteers expressed towards these individuals who benefited. So I'm truly grateful for the opportunity that God has given us so that we can give back to our community.
It was very well planned and executed, and people got what they wanted, and all of us worked together. It was very good to see the camaraderie amongst those from abroad and those on the ground. And really and truly, I mean, it's a drop in the bucket, but it is a very welcome drop.
Today I worked with the pharmacy, and one thing that I really took away from today is the value of hard work. And even though I was working in the pharmacy, I saw that other people were working in ushering, other people were working with registration, other people were working with marshalling. All of them, no matter what their jobs were, they were giving it their all, and it really inspired me and showed me how important it really is that no matter what task you're given, no matter what job you're given, the most important thing at the end of the day is you really taking it on as your own and putting your all into it, because it's people that you're trying to reach, and it's really God that you're trying to honor at the end of the day. So.
This day for me was very rewarding, and it's always rewarding when I can partner with patients to discover what their eye care needs are, and more importantly, to be a part of the solution. So I look forward to the ongoing care of those who have demonstrated that they have deficiencies in their vision, and we look forward to helping to assist them receive visual clarity in the near future.
I think this is what outreach is really about. The ministry is holistic. It's not just the spiritual is being catered to, but the man itself, the whole man. And so it has been beautiful. My wife has benefited from it. And the long and short of it, I saved some money on prescription. That's the truth. But it is good, I would tell people, to just come and be a part of this. The community itself has benefited from this thing. And I'm just overwhelmed by the service that has been given.
Well, I'm very happy to have our company participate in this health fair. There's just a tremendous sense of organization from the minute I walked in. We had a good time looking after the patients. The skills of the doctors and providers here was just on top. And I'm just very thankful that we have Philadelphia Life Center, who has been able to come out and to bring this well-needed service to the community here in Ocho Rios and beyond.
It's such a blessing to be of service to the community, because as the Lord has told us that if we've done it to the least, we've also done it to Him. So we are looking forward to providing service once again, and thank you all for coming out.
Thank you for having us. I think we had a wonderful turnout. Everyone was so welcoming. Hoping to be back again the next time we come.
This is my first medical mission trip, and it's been very eye-opening and an honor and privilege to serve the communities here in Jamaica, and I hope to come back again.
I think the doctors are the best doctors ever go anywhere. Especially my one was the best. My one was the best, and I really enjoy them.
first outcome was that we saw over 300 persons over the 3 days, and they benefited tremendously from the services that were offered in fine style. Persons who did not know what their status was in terms of their blood pressure and blood sugar were made aware of their BMI status, and they got medical checkups, they got to see the eye doctor, and they got to see the ENT specialist. We built relationships with persons from all over these 3 days. We worked together as a team, and it was just a spectacular time. We had sponsorship from the National Health Fund to provide free mammograms and pap smears to 20 women for mammograms and 20 women for pap smears. And some persons had never had a mammogram or a pap smear done before, even though they were in the eligible age group. We had free medication, lots of free medication to distribute to our persons who would normally have had to pay for this. Persons who had normally had to pay for services going to the doctor were able to access it free of cost. So the last 3 days was hard work, but it was well spent. It was a phenomenal time, and I give God thanks for all that we were able to accomplish.
This is day 2, so about roughly 200 persons already, and all the different services. I really like the environment of the service. All of the professionals, the providers of the different services they are flowing in sync with the whole spirit of the Northgate Youth and Family Development Foundation, and the wider empower values are being displayed. People are literally being empowered in terms of it's not just come and get some medicine and go home, but people are receiving prayer, they are receiving counseling, they are being educated on how to take care of their bodies, which is a temple of God. And there's a oneness among the team members. A lot of them are meeting each other for the first time. But we have a group from New York, we have different providers from around Jamaica, plus we have the Congress providers who are core to the whole effort, and they have really been setting the frequency. The providers from the Congress, they have been setting the frequency, the context and the value system of the clinic. So it has really been a powerful time, and a number of pastors have come in and sample what is being offered. They have received treatment as well. So we see that through this avenue we are connecting with the body of Christ in ways that I have never was not expecting, because we sent out the invitation far and wide. So there are a couple, at least 2 pastors who I don't think I would have gotten to talk to them until Jesus comes. But I was able to connect with them, and they were happy that they were being served in this way. So it has opened up the doorway into the hearts of these persons, and of course members from other churches. There's a real interaction taking place with the body of Christ through this outreach. Okay, and I think even the unsaved persons who are coming, they are being impacted, because we realize that this was the template of Jesus. He never just forgave people of their sins and teach the mysteries of the kingdom. He met people's practical needs. He provided their lunches when they were hungry. He provided money to pay taxes. He turned water into wine so the wedding wouldn't crash. And he did all of these practical things. So this, I think this health fair is really capturing that whole approach of Christ, and it's a beautiful, beautiful time so far. And I feel really fulfilled at this point.